This is Sarah with registerednursern.com, and in this video I'm going to be going over cystic fibrosis. And this video is part of an NCLEX review series over pediatric nursing. And as always, at the end of this YouTube video, you can access the free quiz that will test you on this condition. So let's get started. Cystic fibrosis is a genetic disorder that causes the exocrine glands in the body not to work correctly. And because these glands are not working like they should, this leads to major complications in the body, and it affects several systems. One of those systems it affects is the respiratory system, and it affects both the lower and upper respiratory system. And what happens is that thick, sticky mucus starts blocking the airways, and that's one of the big things that I want you to remember about CF. Thick, sticky mucus, because this is where a lot of our issues are arising because of this mucus. So what it does is it'll block oxygenation, puts the patient more at risk for infections, which in the long run, these chronic infections over and over damage the lungs and they have major issues, and it can affect the sinuses as well. Another system affected is the reproductive system. A lot of patients with CF will have infertility issues, have difficulty conceiving or not conceiving at all. In addition, it can affect the skin and the integumentary system. What's in there? We have our sweat glands, which is an exocrine gland. And what happens is that these glands produce way too much salt, so our skin is affected, along with our pancreas. And our pancreas, what's one of the big things it does? It produces those pancreatic enzymes that we need to go into our small intestine to help us digest fats and proteins and important things like that so we can have nutrition. Well, guess what? That mucus is blocking that duct that allows those pancreatic enzymes to flow down into that duodenum, so the person doesn't get that. So they have issues, and plus their pancreas starts to become damaged over time, which can lead to diabetes. And our bile duct that would help drain our bile starts to be affected with this thick mucus. The bile can become thick and gallstones can develop as well. So as you're already seeing, a lot of these systems are being affected, and it can affect the liver. Furthermore, the intestines can be affected as well. Patients can have bowel obstructions, and one thing you're going to see in your infants, one of the first signs and symptoms that some babies will present with is a meconium ileus, where that meconium actually gets stuck in the intestines because of this thick, sticky mucus, and they're not able to pass it, and that's one of the things that tips the physician off, hey, this child may have CF. Okay, so before we dive into our lecture, let's talk about some quick facts about cystic fibrosis. Okay, CF is most common in Caucasians and males. However, it can occur in any race, both male and females, but this is who it's most prevalent in. And some statistics, which are by the NIH, the National Institute of Health, the life expectancy in the 1960s was age 10. Now today it is 37, which is great compared to what it was in 1960. So that's the median life expectancy. Now, it's usually detected in the first year of life, so in our pediatric patients. And what happens a lot of times, they'll present with GI issues, the infant, like I talked about, the meconium ileus, and respiratory issues. And severity of CF is not the same in all patients. And cystic fibrosis is an autosomal recessive genetic disorder, and I would remember that. So what this means is that in order for a child to develop cystic fibrosis, they have to receive one mutated CF gene from each parent. So the mother will give them one mutated CF gene, and the father will give them one mutated CF gene. And that will leave the child with two mutated CF genes, and they will develop cystic fibrosis and have the signs and symptoms and the complications associated with it. Now the parents, if you notice, they have one normal gene and one mutated gene. So the parents are carriers. They don't have the signs and the symptoms of cystic fibrosis like their child will. Now let's talk about how CF is diagnosed. Okay, how it's diagnosed is through a sweat test, and I would remember this test. Now this test is a painless test, and what it does is it measures the amount of salt in the sweat. Because like I was talking about earlier, these sweat glands are producing way too much salt. So they will use pilocarpine and an electrical current to help the skin sweat, and they usually do do this on the arm and have a gauze over the area that's going to be sweating, and it will collect the sweat. And then they'll send it to a lab and they will measure it. And here are how results are interpreted. Okay, 39 millimoles per liter or less, that's considered negative. Patient doesn't have cystic fibrosis. If it reads 40 to 59 millimoles per liter, this means that the test results really aren't conclusive. They either need to repeat the test or need further testing. And a positive result is 60 millimoles per liter or more. So patient has this means they do have cystic fibrosis and have tested positive for it. So now let's talk about the pathophysiology of cystic fibrosis, because this is going to help us understand those nursing interventions and why we're seeing these certain complications in these patients with CF. Okay, so we already know that cystic fibrosis, there's something wrong with those exocrine glands. Now, what are exocrine glands? What do they do? Well, they produce and transfer secretions via a duct. Now, that is different than endocrine glands. Don't get the two confused. Endocrine glands secrete their substances like hormones directly into that bloodstream. The exocrine glands have to go through like a duct or something like that in order to get where it needs to go. Now, what are those secretions? And I want you to remember the secretions because this is the whole problem in cystic fibrosis. These glands will secrete mucus, tears, sweat, and enzymes, specifically pancreatic enzymes. And what's happening, really in a nutshell, is these substances aren't really looking or presenting the way that they should. The sweat, it's producing way too much salt in that sweat. The mucus, it should be thin and slippery. Instead, it's thick and sticky, which leads to blocking passageways and providing a great environment for bacteria to live in. So really, pancreatic enzymes and mucus really go hand in hand together because the mucus is blocking that pancreatic duct from delivering those pancreatic enzymes. Now, why aren't these exocrine glands doing what they should? Well, they have a mutated gene that makes them up. So this prevents those endocrine glands from doing their job properly of producing the mucus, the sweat, the tears. And what gene is that? The gene is the CFTR gene. And this stands for Cystic Fibrosis Transmembrane Regulator, which is why we call it CFTR. And this name is fitting because it really tells us what this gene does. Okay, cystic fibrosis, it's related to that. Transmembrane. Trans means across, through. So it regulates something going across or through this part of the exocrine gland. So CFTR, what it normally does when it's not mutated is that it's a protein that controls the channels of sodium and chloride. So in other words, it's controlling the sodium and water in and out of that exocrine gland cell. Now, what's happened in CF, it's mutated, not working. So what's happening to our mucus? What should it be like normally? Thin and slippery. Here it's not because this regulation of the sodium water ain't happening. So what's happening is that it's thick and sticky, and this is where we're seeing a lot of our problems. So let's talk about where we're seeing our problems. Respiratory system, the lungs. Okay, thick sticky mucus is going to block airways. And when you have these airways blocked in here, what's happening to this lung tissue, those alveoli sacs? They're not working good. And what's going to happen is that the patient's going to experience obstructive pulmonary disease, such as emphysema. And this is going to lead to hyperinflation of the lungs, so they're enlarged where they shouldn't be. And this can cause air trapping in those alveoli sacs, which can lead to blebs rupturing. And when one ruptures, this can lead to a pneumothorax where half or part of that lung just completely collapses, and then we're in big trouble and the patient needs chest tubes, some type of treatment fast. In addition, all that strain on the lungs can lead to pulmonary hypertension. You can see that in a lot of your patients who are older with cystic fibrosis, and that pulmonary hypertension is going to put a lot of workload on the heart, which in the end can lead to heart failure. And you can see nail clubbing in these patients due to where they struggle with proper oxygenation, and bloody sputum. You're not going to really see bloody sputum in your infants and in your children, but in your teens and your young adults who have CF, the bloody sputum can be just where they're experiencing severe lung damage or they have an infection present, which leads me to infection. One huge thing you need to remember as the nurse is that your patient with CF is majorly at risk for infection because that mucus just isn't really good mucus, and it's a great place for bacteria to thrive and survive and cause your patient a lot of problems. So if you've ever taken care of a patient with cystic fibrosis, they have been probably on a lot of antibiotics throughout their life. And some common bacteria they can get is like Pseudomonas or Staphylococcus aureus, things like that. And the trouble is because they have to take antibiotics a lot, there is issues with antibiotics becoming resistant to the bacteria and the person having allergies to the particular antibiotics, and so the physician's limited in what they can prescribe the patient to take to fight these infections. And a lot of patients with cystic fibrosis, the lung issues and the infections causes a high mortality rate in these patients. Now, these patients, because of the lung issues that they have, they're excellent candidates for lung transplants, and a lot of patients do get lung transplants and they are a lot better after they have that. Now that was really talking about our lower part. Now it also can affect the upper part of the respiratory system, the sinuses. A lot of patients end up having to have sinus surgery to help with their sinuses. They can also develop nasal polyps, which can cause stuffiness or snoring. It also affects the GI system, and it affects several structures within that GI system. First, we're going to talk about the pancreas. Now, what does our pancreas do again? One of the things it does, because it does many things, is it produces pancreatic enzymes that are, in a sense, squirted into our duodenum, which mixes in our small intestines and helps us absorb important substances. Now, what are those pancreatic enzymes? I like to remember the word PAL because it's a PAL to us to aid in digestion, and it includes like protease, amylase, and lipase. Those are the three that we're not getting in CF. They're being blocked by thick mucus in that pancreatic duct that would normally drain those down into the duodenum. So these three pancreatic enzymes helps us with digesting vitamins, fats, and proteins. Now, if they're staying in the pancreas and not coming out where they're supposed to, that's going to cause some problems in that pancreas. It can cause damage, inflame it, and lead to fibrosis of the pancreas, which can alter the body's ability to control blood sugars. So the patient can develop cystic fibrosis related diabetes, where they will have hyperglycemia. They can also have drops in their blood sugar, and they'll have to be treated for diabetes because of damage to that pancreas. So what you can see in your patients, okay, well, they're not digesting fats. They're going to have weight loss because they're not getting the fat that they need. They're also going to have malabsorption, which is going to lead to not absorbing those vitamins, especially those fat-soluble vitamins, which are, I like to remember at DECA, vitamin D, E, K, and A. They're going to have to take those as a supplement. We're going to be giving them those, and you'll learn about that in our nursing interventions. Also, they're going to have issues with low protein because they don't have those enzymes to help with those proteins, so they can struggle with that and have some swelling. In addition, they can have delayed puberty, and a lot of these patients are going to have a feeding tube, and it's going to help them get that extra nutrition that they need to help them during these times, because especially during times of infection, when they're sick, they don't feel like eating, their body demands a lot of calories and protein, and that's really the type of diet that these patients want to be on. So a lot of times these patients are going to be prescribed pancreatic enzymes, and you want to remember that, especially whenever we go over that here in a second in our nursing interventions. Now, if your patient's on pancreatic enzymes, they should not have the following. Whenever they're low on pancreatic enzymes or don't have any at all, their stools are going to have a unique look to them. They'll be greasy because all that fat is coming out into the stools. Also have a foul odor, abdominal pain, and bloating. So always be assessing your patients for that, because if they are on pancreatic enzymes and they're still having that, the physician may want to readdress that to make sure they're getting a proper dosage of pancreatic enzymes. Another structure affected is the liver, and the liver plays a role with our bile ducts, and what can happen is that thick mucus can block that bile duct, which can cause the bile to become thick and can lead to gallstones in the gallbladder, so watch out for that. Intestines as well are going to be affected. We talked about in our infants, they can develop a meconium ileus, and we all know from maternity nursing that meconium, that's that first stool that an infant will pass after they are born. We're always looking for that. We want that to come out. Well, a child with CF, that meconium gets stuck in the ileus, so they have meconium ileus. Also, patients can develop DIOS, which is distal intestinal obstruction syndrome, where stool and thick mucus get together and get stuck in the intestine and cause a blockage. So a lot of these patients are going to be on like Miralax, some type of substance to help prevent constipation and keep things moving through there. Next is the reproductive system. And as I said earlier, patients with CF have issues conceiving children. And why is that? Well, it goes back to the thick, sticky mucus. For women, the reason is because cervical mucus normally plays a huge role in getting pregnant, because the cervical mucus will help the sperm travel up to where the egg's at. Well, in a woman who has CF, that mucus is thick and sticky, not very sperm friendly, so the issues with conceiving are a little bit more difficult. For males, the vas deferens duct, which helps deliver that sperm, sometimes it's not even developed correctly, or it's blocked with mucus, which allows that sperm not to get out and fertilize an egg. Our other system is an integumentary system, and we talked about those sweat glands. They're producing too much of what? Salt. So they have very, very salty sweat and tears. Now that can lead to some problems. They can have electrolyte imbalances, and they can experience dehydration. So during episodes where they're having a lot of sweat, they're excessively sweaty, exercising, doing something strenuous, they may have to take extra supplements of salt to help with that. And that is why that sweat test that we talked about earlier is great at diagnosing cystic fibrosis, because it measures the amount of salt, and these sweat glands are producing just way too much of it. Now let's switch gears and let's talk about nursing interventions and treatments for patients with CF. Okay, as a nurse, we're focusing on mucus. We want to really focus on that mucus in the respiratory system and help them clear that out to prevent any respiratory problems. In addition, we're focusing on infection, how to prevent it, how to take their antibiotics, monitoring them for infection, let them know that you're at risk for it. Nutrition, are they getting enough calories, enough protein? How do their stools look? Do they need more pancreatic enzymes? How are they doing? What are their weights? And GI blockages, making sure that they know the importance of taking their Miralax, the signs and symptoms of a bowel obstruction, things to look for with that. So first, let's talk about the mucus, okay? Because that is our big thing with the airway being blocked. And how we can do that and help the patient clear their airway with this thick, sticky mucus is through number one, chest physiotherapy, which is chest PT, which will include postural drainage along with percussion, vibration, huff coughing to help expel that thick mucus. Also using PEP devices, those positive expiratory pressure devices, which we'll talk about here in a moment, and using nebulizers routinely and as prescribed. And this can include anything from like bronchodilators, mucolytics, anti-inflammatories, even saline sprays and nasal sprays to help with the sinuses and things like that. And if you've ever taken care of a patient with cystic fibrosis or have a family member who has it, this is a huge part of treatment, especially this chest physiotherapy, the chest PT. So let's talk about it. What is it? Okay, this is where the airways are going to be drained of that thick mucus, that sticky mucus that's in there, and it's going to be coughed up. And what they do is they do postural drainage, and this is where you get in certain positions, different positions, to help drain the lobes of the lungs. And while they're in these positions, they will have percussion, where you take your hands, cupped hands, and you go over those areas of the lung field. Some patients use the vests that cause vibration to help do that. All depends on the patient. If you do percussion, you want to watch out for those bony prominences like the breastbone, the ribs, going over the stomach, going over where the areas of the kidneys, the spine, things like that. You don't want to cause injury, so make sure you watch that. So they will have the percussion, the vibration, the drainage, the postural drainage, and then in between sessions, however the physician wants them to do or whatever the patient does, they will stop and do huff coughing, which is a special technique where they huff and then they cough. So they'll go and then cough, and this will help expel that mucus that they're helping drain from the percussion and the postural drainage, and they'll spit that out. Now, this is done a lot through the day. This takes up a big chunk of the day for a person with cystic fibrosis. They do it anywhere from 2 to 4 times a day or even more, depending on if they're battling some type of respiratory infection, whatever's going on with them. Sessions can last anywhere from 20 minutes to an hour. Now, tests, remember this. When is it best to perform chest physiotherapy if you're asked this on a test? Usually it's best you want to do it when their stomach's empty, because if we're going on that chest and we're percussing and they have a full stomach, what's going to happen? They can possibly regurgitate their food, aspirate it, have reflux. So we don't want to do that. So about 1 to 2 hours after a meal, so in between the meals is when you want to do it. Not before, because the reasoning for that is if you're doing this percussion and they're coughing up their mucus, you do your session from where they've coughed up that mucus, which can have a bad taste, a smell. It can decrease their appetite. They won't want to eat their food after they've just been coughing up all this mucus. So it's good to do it in between those meals. Another thing that helps with mucus is the PEP devices. And again, that was the positive expiratory pressure devices. And how do these work? They work with helping clear the airways by assisting moving mucus from out of the lungs. So what the patient does, it's like a handheld device, and they breathe in and out on this device, and it creates a vibration and some resistance, especially whenever they breathe out. And this helps that mucus migrate upward, and after they do that a few times, they huff cough. And huff cough will help them expel that mucus, and they will do that to help remove it. Now, some device names are like the flutter valve or a capella, so just to be familiar with those. Another thing is aerobic exercise. What this does is it helps strengthen the lungs and it helps clear secretions. But you want to educate the patient to make sure that if they are experiencing a lot of excessive sweating, they may be at risk for needing salt supplementations, along with watching their calorie intake, because naturally a patient with CF needs high calories already. So if they're doing strenuous exercise, they may need to increase their caloric intake even more. And of course, they're at risk for infection. So during those times when it's flu season, or they're just feeling unwell, they're having some respiratory issues going on, when they go out in public or around others, they'll want to wear a mask so they won't get those germs. Also, strict hand washing, of course, vaccines, making sure they're up to date with their flu, their pneumococcal, and all those other respiratory illnesses that they can get, and we have a vaccine for. And of course, avoiding sick people. Now let's talk about nutrition interventions, because we know that they're at risk for nutrition problems. And why is that? Because those pancreatic enzymes can't get into the small intestine to help them break down their food. So they're going to need some help. Okay, they want to follow a high caloric, high protein, high fat diet, and they're going to want to be taking supplements, fat soluble supplements specifically. And again, what were those fat soluble vitamins? D, E, K, and A. So remember those. Also, they're going to be taking pancreatic enzymes. Some common ones are pancreolipase or pancreatin, and these are going to help replace those pancreatic enzymes that should normally have left the pancreas and went to the duodenum to help to digest the food. Now, normally they'll swallow these in a capsule, but if you have a 2-year-old patient, they can't swallow these pills, so you'll have to open up the pill and sprinkle it in food. You want to educate the patient's parents, and just for yourself, you don't want to crush it, or the person doesn't want to chew it, and you want to mix it in an acidic food like applesauce, not something that's alkaline or milk-based, because once these enzymes hit that alkaline or milk-based product, it will inactivate the enzyme. So don't give it with like ice cream or pudding or yogurt, anything like that, because it can mess up the enzyme. Now test. When, as a nurse, are you going to give these pancreatic enzymes, or you're going to educate the patient when to take their pancreatic enzymes? They will want to take them before all meals and snacks because it'll aid in digestion. So before. Next is the GI blockage prevention. What interventions are we doing for that? Okay, we want to tell our patient to drink plenty of water. This is going to help keep those mucus secretions as thin as they can be, hopefully preventing a blockage. Also, most patients are prescribed by the physician some type of stool softener to take daily. Popular one is polyethylene glycol, which is a long word for the word Miralax, and they take that and educate them about the importance and why they are having to take that. And some signs and symptoms of a possible blockage would be not having a bowel movement, can't pass stool, they can't pass gas, and they're having abdominal pain. And again, that cystic fibrosis, diabetes, related diabetes, they may have diabetes, so you want to monitor their blood sugars, educate them about signs and symptoms of hypo or hyperglycemia, to watch out for that. And they may need treatment for their diabetes with insulin. Okay, so that wraps up this NCLEX review over cystic fibrosis. Thank you so much for watching. Don't forget to take the free quiz and to subscribe to our channel for more videos.